Hey everybody, John Malanka with United Patients Group. Be informed and be well. This segment is brought to you by Aspen Green. Aspen Green is just a handful of USDA certified organic hemp and CBD brands, and all of its hemp is grown from the perfect topography and climate found in Colorado. Check out why purity matters at aspengreen.com and follow them on social channels at Aspen Green CBD. Use promo code UPGCBD for 20% off. Hey everybody, John Malanka here, United Patients Group, and just finished a great informative podcast with board certified gynecologist, Dr. Becky Lynn. She and I have worked together before, and she's a wealth of information. Wanted to bring her onto the show. And we talked about not only better sex, but heightening pleasure and reducing pain. Reducing pain is when something comes up quite a bit. And so she has shared her experience of being a board certified gynecologist by using cannabis, both CBD as well as THC, and the inhalation methods via vaporization, via tincture, as well as lubrication. We talked about reducing pain with endometriosis and a couple other ailments that women do go through. So thank you, Becky, so much for sharing your knowledge. And for our listeners, I hope you're going to enjoy this. I know you'll enjoy this. So please leave your comments down below. If you haven't subscribed to our channel, please subscribe, and we'll keep on putting information out like this for you, our listeners. Have a great day. Bye-bye. Hey everybody, John Malanka, United Patients Group. Be informed and be well. And here's another topic. We talked about sex a few weeks ago, and for some reason it's a hush-hush topic and people get embarrassed. Even I get embarrassed talking about it sometimes. So, but this topic is going to be learn how you can enhance your sex life naturally by using hemp and CBD for both men and women. Get all the facts, including dosage, frequency, and when to use it safely as well as effectively. So better sex, heightening pleasure, and reducing pain, And I'd like to introduce you to our next presenter, Dr. Becky. I always say Coffin. I know that's your middle name, but Dr. Becky Lynn. Hi. Hey, Becky, how are you doing?
Good. Thank you for having me. I love talking about this stuff.
Yeah, well, thanks for being on here too. And let me read your impressive bio first off. So Dr. Becky Lynn, I'll say Dr. Becky. Dr. Becky Lynn is a director of Evora Center of Menopause and Sexual Health. She's a board certified gynecologist and trained sexual counselor and menopause provider. She is also an adjunct associate professor of obstetrics and gynecology at St. Louis University School of Medicine. Dr. Lynn is a world-renowned expert in sexual medicine and menopause. She's a frequent invited speaker on women's sexual health and appears regularly on numerous podcasts, television shows, radio shows, as well as in print. Known for her patient partner education YouTube channel, which everyone should check out, and her research on the effects of cannabis on sexual experience. She's been featured in More Magazine, Self Magazine, as well as Martha Stewart Living. So, whew, all in one breath.
That was good.
This is a topic. So are you ever embarrassed talking about this, or do your patients come in? No, you're used to it. It's just like,
I've been talking about, I'm a gynecologist, so yes. I've been talking about sex for years, so it really doesn't faze me at all. But I will say, some of my patients have no problems talking about sex. Other patients can't get the word out.
Yeah.
And I have to say the word for them. So it definitely varies.
And you have two sons, right? I know you have two.
I have one daughter and one son. And
so you are not only, I guess, everything's open from being a gynecologist to cannabis.
They get embarrassed when I talk about what I do, but I think it's good because they get good education from a reliable source about sex rather than, learning everything from their friends or from the internet. So
yeah. And I don't know why, I come from a very open family. We talked about everything, but you still have that. I don't think I would ever have my conversation with my mom like that. So I applaud you. I think it's really important and healthy. And I bet when they get older, they'll realize how cool their mom is to have this topic as well. So can you tell me a little bit about your practice? And I know you're in Missouri. Mm-hmm. And so can you talk about your practice, how you got involved in that space of gynecology, but also in including cannabis into your practice?
Sure. So, I'm in St. Louis. I run Evora, where I specialize in menopause and sexual health. I just opened Evora in February. And before that, I was full-time faculty at St. Louis University. Now I'm adjunct faculty there. But the way that I got into the space, I think it's kind of funny and a funny story how this all happened, because I never set out in my life to be the marijuana sex doctor. Like that just wasn't on my list of what do you want to be when you grow up. So, but when I was at St. Louis University, I was seeing many, many women with sexual problems like low libido, painful sex, orgasm difficulties, things like that. And I noticed that I would get women who they'd come to me and say, well, I have low libido, but when I smoke weed, it's great. Or I can't orgasm, but when I use marijuana, I can. And I think, many women were embarrassed to say that because recreational marijuana is illegal in Missouri. And at that time, medical marijuana was illegal also. It's legal now in Missouri. Mm-hmm. But it sort of opened the door. And I thought to myself, is there any data to support that? Are there any published research studies? And so I went to the medical literature and I looked, and there's really, at that time, especially, not much in the way of studies that have to do with sex and marijuana, except for rat sex and mating activities and hamster sex and all that. That's where the data was. There were a couple questionnaires, but I mean, really not much in the way of human studies because it's been illegal. So what we designed at St. Louis University was a questionnaire looking at women's perceptions of sex when they use marijuana before sex. So we looked at several different domains of sexual function. We looked at overall sexual satisfaction, libido, orgasm, pain, and lubrication. And we found that the majority of women reported better overall satisfaction, better orgasm, less pain, and really no change in lubrication and improved libido. And then we also found that people who used marijuana and before sex and used marijuana more frequently were more likely to report better orgasms they were twice as likely to report better orgasms in general, not related to marijuana use before sex. So, I'm really glad I looked into that because I also had gone to the internet before I did that study, and there's all sorts of data on the internet. And so in my mind, it answered a good question. And, now the doors are opening for research. And I think that's fantastic.
I think, as I mentioned at the beginning, the taboo of talking about sex, I don't know why, as well as the taboo of talking about cannabis. And so you're in a practice where I think the conversation and opening the doors, as you're mentioning, especially in a state, Missouri, who's, I don't say behind, but you have California, where you're from, has been
late, yes, definitely,
since 1996. And so I have a lot of followers and a lot of patients that call us on a regular basis, and they said, can I get in trouble at having this conversation? Yes and no, please, I don't want you to be in, so for our listeners, it's not, even if it's illegal in your state, it's not illegal to ask a question. And so, so be open. If your doctor's not open to this, ask their doctor if he or she can give you a referral. If not, do you see anybody, Becky? Do you work with patients outside of Missouri? Can they call you?
Well, so they can call me and I can talk about marijuana, but I can't prescribe or see them as a patient outside of Missouri because I have a license to practice medicine only in Missouri.
In Missouri, okay. And so with cannabis, when you're seeing all this success, is it because it's lowering, the stress level or opening them up? Is this what you're seeing in your practice or the studies that you've researched on?
Yeah, so we don't know 100% why it seems to help, and also I want to point out it doesn't work for everybody. There's some people will get paranoid, or some people, if you smoke too much marijuana and you can't move, that's not good for your sex life either. So I just want to preface that. But now I forgot the question. What did you just ask me?
I don't know. Probably with your research and what you're seeing, the patient opening up and being more relaxed to have a better experience.
Yeah, so there are a couple theories as to why this happens. Definitely it can lower anxiety. So if you're in a situation where you're a little nervous, it's a little anxiety provoking, it can help that way. Then marijuana enhances sensation. So whatever, taste, smell, touch, all of those seem bigger to some people on marijuana. And then marijuana can slow the perception of time. So I think that's why people respond to it in terms of sexuality.
We always talk about the positive stuff and the pros. Are there any cons? I know you mentioned about anxiety being passed out. We don't want anybody to go there. And can you talk about that, please?
Yeah, any drug, there's always going to be benefits, risks, and side effects. And if anybody tells you this drug doesn't have any side effects, that's a big lie. But yeah, so, like I mentioned, not everybody responds to marijuana the same way. Some people, they don't like how they feel or feel like they can't breathe or they're paranoid. You can definitely smoke too much marijuana. And the other thing is you really have to be careful of the situation that you're in. So, I would never say, oh, I don't know this person very well. I've never been with them before. I'm just going to smoke marijuana, because you can get yourself in a bad situation. And I think we talked about this the last time we talked about consent. And so you really, and you also don't know how you'll respond. So the other thing that I recommend for people who want to try marijuana to see if it enhances the sexual experience is try it in a safe place. Maybe try it by yourself and see how you do before you bring it to somewhere else where it's a little more complicated.
And it's not a one size fits all, and less is more. And so I like you're saying, do your little dry run, so to speak, before you have your date, or even have the communication with your partner. I know you're in gynecology, so do you ever have their partner in, if it's a female male partnership?
Yes. So I have partners in female male. So I think it's really important because, apart from the marijuana side, I see a lot of people with sexual problems in general, and you can get so much more information sometimes when the partner's there. So partners are always welcome. I just think it really helps me help them.
And repeat that. You broke up on that last part. I'm sorry.
So having the partner there helps me help them.
Yes.
I think it's really important. And I also do some couples counseling. So as a sexual counselor, it's when I sort of change my hat and become more of the sex counselor instead of a gynecologist, then I have skills that I can tell them both that can help enhance their sex life.
Are any of your patients that are coming in with, when you become the sex counselor, coming from of trauma in their life, if it's something as awful as rape or molestation, or not feeling that they're good enough for their partner? I mean, is this something that you work with as well?
No. So that is definitely beyond the scope of my practice. So if they really have sexual trauma that is contributing, or just sexual trauma, I will refer them on to somebody who's really specialized in that area. And I do that fairly often because, as you can imagine, people who've had sexual trauma, it will affect their sex life going forward. So I do refer them because I'm not a psychologist.
Okay. Gotcha. Well, you've been impressive so far with all your hats. I didn't know if you threw that in there. Endometriosis. I know this is about better sex, heightening pleasure, and reducing pain. On the reducing pain portion, buddy of mine that's been we've known each other since 6th grade, and his daughter's going through endometriosis. So he calls me up. He's over in the East Coast, and he's just like, help. What do I do? His wife passed away, and so now he has a teenager at home, and he's trying to be mom, dad, everything. And
tough.
Can you share any of your knowledge on that?
Yeah. So I see many women with endometriosis, and basically what endometriosis is, it's where the endometrium, which is the lining of the uterus, that you shed each month when you have a period, that lining can be in the abdomen and pelvis and implant on other organs like bowel, like bladder, like ovaries, pelvic sidewall. And it causes a local inflammation, which causes a lot of pain. And so people with endo can be in horrible, horrible, horrible pain. And so there's a variety of things you do for endo before you would ever consider marijuana, especially in a 16-year-old. I wouldn't consider marijuana in a 16-year-old. But it's very important to see somebody who's specialized in endometriosis. There's a fellowship for MIGS, which is minimally invasive gynecologic surgery, which she might want to consider. And like I said, I'll look into that. But where they go in and surgically through a laparoscope, so little incisions, remove the endometriosis, and it can make somebody feel so much better. But there's a variety of other things you can do to help it. But yeah, endo. And when it comes to endo, some women will develop chronic pelvic pain really, really bad. And then they can develop pain with sex or pelvic floor muscle spasm, which then all this chronic pain leads to depression and anxiety. And it's just this like downward spiral. So it's definitely a significant thing. And where marijuana comes into that is that the reproductive tract, the uterus, the tubes, the ovaries, the cervix, the vagina is chock full of cannabinoid receptors. So marijuana binds to a lot of those receptors in the reproductive tract. And so you might say, well, why are they there? That doesn't make sense. But we have our own cannabinoids, which we call endocannabinoids, that our body makes, and they play a role in menstruation and fertility. They do a lot in the reproductive tract. But where there's interest, as far as endo goes, is using marijuana to treat chronic pelvic pain. And so I'm so looking forward to see the studies that come out, since the doors are opening, to see if it truly works with good, high quality studies to help with pelvic pain. Anecdotally, I've seen it work.
Are you seeing, can you talk, two things. One, before I forget, can you talk about the receptors down there, please? Because I think a lot of people, even me, don't realize that there are receptors there. And are there receptors in the male reproductive organs as well?
Yeah. So being a gynecologist, I actually don't know for sure, but I would guess that's a yes, because we all start out the same and then we kind of differentiate. But I haven't looked at the data myself. But a receptor is basically, it's like a lock and key mechanism to send a cellular message. So you have like the lock and then you have the key. So the lock is the receptor, and then the key is some little molecule like marijuana or your own endocannabinoids comes along and goes into the lock, and it makes the cell that the lock is on do something different, or maybe sends a message to raise a hormone level or something like that. So, but the endocannabinoid system in general is thought to be responsible for homeostasis. So what that is, hopefully I'm not losing the listeners, is balance. So it's kind of like, let's say you're, sitting outside in the heat, your body wants to be a certain temperature, but you're getting hot. And so there's, things in your system that tell your cells and your blood vessels to dilate and release heat. So maybe your face gets flushed and you sweat. So because you're trying to cool down, you're trying to stay at that homeostasis. You want that's why we don't live at 107 and then we're 98.6, because there's these mechanisms that get us back to balance. The other place where you can see that, especially in the CBD marijuana world, is seizures. So, our nerves are in a relaxed state, but then nerves fire, right, to send a message somewhere. But some people have seizures where the nerves are firing, and marijuana and CBD, especially like in children, can control those seizures, preventing them from happening because it's trying to bring everything back in balance.
You mentioned body temperature. Did I dream this just recently, like in the last week?
Yeah.
Our core body temperature has changed over the years, or what normal is. Did I hear that or read it somewhere?
I don't think you're making that up. I think that I heard something like that too, but I heard that we've been wrong all along. We're really 98.6. I think I thought I heard that we're a little lower or something like that.
Maybe it was the same dream. I mean, I was thinking about, but yeah, I think just in the last 4 or 5 days, I thought I came across that too. You mentioned, so again, homeostasis, bringing the whole body back to balance, and great descriptions, by the way. So no, you're not losing anybody. It's very informative, and I'm a visual guy, so the lock and key was great as well. With your patients, are you recommending ingestion via smoking, inhalation, or tinctures or topicals down there for pain relief? And then can you talk about heightening pleasure? Is it part of lubrication? Does the patient, if they are using a lubrication, can the patient get high?
So there was a lot of questions.
I know, so let's go with when you recommend, is it inhalation via tincture, smoking, droppers, or lubrication?
So vaping is probably the safest way to inhale it. Because if you smoke it, it's at such high temperatures, there are toxins, just like smoking cigarettes. So you get those toxins there. Tinctures are good too, because there's no toxin there. You're not hurting your lungs, and it's pretty direct mechanism right to the bloodstream. And both of those have a quicker effect than edibles. The problem with edibles is you don't know when it's going to hit you. So you have a little bit less control over it if you're using it for sex. But as far as health goes, then the vape or tinctures.
Can you use a tincture that has like an MCT oil base as a lubricant? Is that safe, or would you kind of stay away from something like that?
So, what is MCT?
Excuse me, MCT is like coconut oil that a lot of
coconut oil is great. So here's a good point about, well, can you use it as a lubricant? So I've not seen any published studies, like in medical journals, that looked at using like a CBD lube or a marijuana lube or 1-to-1 ratio and looked at the blood levels. So we don't know how much is absorbed. We just don't know how much is absorbed. So, but I know that there are a lot of products that are suppositories, lubricants, tampons, things where people are using it, but we just don't have good information as to how much is absorbed and what affects how much is absorbed.
It's funny because we did an article, years ago, Corinne and I wrote an article about suppositories but rectally is the posterior superior, is what we entitled this article. And we had, believe me, we caused World War III from patients saying, yes, it worked. Some doctors saying, yes, it worked. Other doctors saying impossible. And so everyone was, I finally said, God, I wasn't trying to start a major war. But sometimes, if something works, maybe a placebo for a patient, and it's safe, continue on. Their thing, when I say the people that said impossible, back in the days, you would, I would say 60s, people were putting, I shouldn't even say that, even for children, doing aspirin, don't parents in young children sometimes put an aspirin rectally. Did that still happen?
No, I wouldn't do that, because little kids shouldn't have aspirin, but there are drugs that we use rectally. So
that's a bad example on the aspirin. But they're saying that if you put cannabis rectally or cannabis via vagina, that the patient's not feeling anything. It's not
absorbed.
Is that true, or what are you seeing with that?
Don't know if it's absorbed or not. Don't know. But there are medicines that we use rectally because there's a lot of blood vessels down there. So it's sort of direct absorption into the blood vessels.
With all these different types of products are out there, and you're in Missouri. Is there something that you have your patients look out for? I mean, I know we put our list of, things to ask, what questions, what you're putting in your body. I think everyone should always see if it's a tested product. Is it
certified?
Certified, exactly. USDA certified. I'm a fan of some of these hemp products that are out there right now that you and I have worked with before. Can you give me a little walkthrough of what you would do with your patients? And again, for our listeners, this is not to replace a one-on-one with your gynecologist or your medical professional. This is for information, educational purposes. And thank you, Becky, for doing that too, by the way.
Yeah, sure. So so you have to be careful when you buy CBD in general, because I think, the FDA did a study where they looked at different products, and what the product said they had in it was sometimes not what was actually in it.
Yeah.
Some CBD products had marijuana, others had CBD, others had nothing. So you do want to go with a certified place where it's been tested, and it's not really regulated per se, but it's more regulated. And so what I've done in my office is I have chosen a couple companies who make CBD and CBD lube that I know and trust, and I sell them in my office. And I think that's better than going on the internet and, picking the one with the prettiest marketing, because that definitely happens. When it comes to marijuana, so medical marijuana, the dispensaries have just opened in Missouri, like within the last month. And there's one that I know the people who run it, and they've had dispensaries and cultivation and all sorts of things in Illinois, in Southern Illinois, where all marijuana is legal, and I like them and I trust them, and I know they're running a good organization, and they have a couple dispensaries. So I tend to find the ones that I trust, and that's what I would recommend.
That's the way I usually do as well. People that answer phones, have their information up there, test their products. I go with the ones that grow their own products, so they're not a third party. And like you said, I mean, you and I can go start a cannabis company today or a CBD company today, and if we have millions of dollars for marketing and have the prettiest label out there, and it could be crap on the inside. And so I always tell people, we've all been guilty of judging a book by its cover. And even in the cannabis industry, I can't tell you how many times I've picked a product, but it's a beautiful label, beautiful cover, and I get on the inside and read it, and it's like, I can't believe it's even being sold. And so thanks for, I'm glad we see eye to eye on that. With CBD more available for your patients, especially in Missouri, how are you incorporating that into your practice? Because you've been doing this a lot longer than CBD and cannabis has been in your practice. And so what made you do that paradigm shift to get into say, hey, here's another tool for our tool belt to help?
So knowing what I know about marijuana and then learning about CBD as I was going along with my research, CBD is an analgesic, but it hasn't really been studied as a lubricant for sex. But I have several patients who have chronic painful sex, who have tried everything. Like they've gone to Mayo Clinic and they've been to the East Coast and they've tried everything that has been in our toolbox for chronic pelvic pain, including dyspareunia, which means painful sex. And, and they're like, I'm at my wit's end. What can I do? What in the world can I do? And so I found out and I learned there were CBD lubes, and I'm like, what do you have to lose? Just try it. And so anecdotally, I mean, like really, as long as it's from a reputable source, you have nothing to lose. And anecdotally, I've seen it work great for people who have what's called vulvodynia, which is where it's pain on the vulva on the outside of the vagina. And it's not due to like a yeast infection or due to something else. And I've been like amazed. And I'm a very like science data driven person. So what I'm saying about the CBD lube is purely anecdotal, but I've seen really good results. So that's why we sell it in our office. So that's where I use it in those chronic pain patients.
Cannabis has been known as being an antifungal as well. And so you think that's a reason?
No, because in all my people who come in with this chronic vulvar pain, they've all been screened for yeast. They've been treated for yeast umpteen times, and it's not making their pain go away. So by the time we get to that point, we know it's not yeast.
Gotcha. What's your, you must see youth to adults. Is this something that you would recommend for the 12 or 13-year-old girl over the 40-year-old woman, excuse me?
I don't really see that many adolescents, actually.
Okay.
And because we have a really good adolescent gynecologist in town. So for the patients that I'm usually 18 and older.
Okay.
And it really doesn't matter how old they are. If they have vulvodynia or painful sex, I think they can try it.
And more so tincture wise, right? Because I know you're not a fan of
the lube. They can try the tincture, but I've seen the lube work really well.
Gotcha. Okay, I lost you on that one for a bit. Sorry about that. Yeah. So you were talking about. I know we've combined a few different topics.
Yeah, sorry.
But you were for your patients that are having issues. What did you call it? Vulva? What is it? Sorry?
Vulvodynia. So that's like pain on the vulva, which is the outside of the vagina. And it's not due to anything else. Like there's no lesions, no herpes, no other something. It's just like they just have pain. And
that's where you're talking about in regards to lube.
Yes.
Gotcha. Excuse me. Okay. Now we're back on track. Fast forward, rewind. we're good here too. Well, good. And so where do you see the future of cannabis going? Not only in your practice, but and the studies that are out there, and like I know you mentioned a lot of rodents, all the studies, unfortunately, are on rodents, and you know the U.S. is not leading the way when it comes to cannabis research. I think one because of the Schedule I that it's in, and it's still a gray area, even with the CBD saying, oh, we're legal in all 50 states to purchase CBD. You know, you're looking. China's leading the way, you know, Europe's leading the way, Israel's leading the way, South America, Canada. And for some reason, this little country called the United States is, you know, we're still just doing rodent testing. And are you seeing any light at the end of the tunnel for this?
So I do think so. I think the United States is pretty conservative, like compared to Europe.
Yeah.
So, and of course, you know, we have the issue with it being legal in some states and not others and still being federally illegal. But I'm sort of looking to Canada to, now that it's legal everywhere in Canada, to have some good high quality studies. So by that, I mean, you know, like a randomized, you put people in two groups, one person gets a placebo, or one group gets a placebo, the other group gets the drug, marijuana, and then you see how they respond. And that's what makes for a good quality study. And that's really hard to do. I mean, you could do it. You can definitely do it here in the States, but it's difficult with the funding and all that stuff. Whereas Canada, I think it would be easier.
But in your practice, you're continuing to go. I mean, I know you're a board certified gynecologist. So I know we're in COVID right now. So I'm assuming you're not going to conferences. Before this hit, which I can't believe is coming up to a year. I mean, literally a year ago now. I mean, it's just like crazy. Are they talking about it at the gynecology conferences about cannabis? Because I know it's starting to happen in pharmacy conferences, integrative oncology conferences.
Right. So I will say the only person talking about it at the conferences that I've gone to is me. So, you know, I'm on the board of ISWISH, which is the International Society for the Study of Women's Sexual Health. And I've presented my data a couple times, and I've I have a review on cannabinoids and sex in one of their journals. But I haven't really, let me think about, no, that's not true. So I did a virtual meeting this year because of COVID with the International Pelvic Pain Society. And it was sort of like a breakout session, a discussion of medical marijuana's use in pelvic pain. And so I went to that, and I will say everyone was so hungry for more information. So yeah, I'm not the only one. They talked about it at their meeting too.
But I think what I'm finding when I do go to these conferences, the pharmacy conferences, the oncology conferences, that everyone's jumping on board and they don't know the warnings, as you were talking about, of a pretty label doesn't mean what's in the inside matches with label. And so when I hear these doctors say, oh, I just picked up this, I'm like, oh my gosh, that is the worst one you could be offering. And I've said it even to our own naturopath. I said, to see that you know that Corinne and I have been your patient for years, and to see that you're recommending this, and maybe they're watching or not, but I love them. You know, it kind of worries me that all the other products that I'm taking are up to standard. And, you know, and when I said that, they kind of looked at me and said, you know what, you're right.
Oh, wow.
And so, but ask questions. For you, a patient, ask, you know, has it grown here in the United States? Does it have lab testing, QR codes, batch number, expiration dates? Is it organic? I mean, these are all just things that same thing you're putting in your body this way, food wise, you know, that you're using this and treating this as something to bring your body back to homeostasis and balance. Well, I appreciate your time, Becky, as always. What can you tell me a little bit about Evora Center of Menopause and Sexual Health, and how they can find you? And I know your state license in Missouri only, but what can you share for our Missouri clients and beyond?
Sure. So the best way to find me is, well, you can go to my website, which is Evora. So it's EV as in Victor, ORA.
Yep.
I wish I didn't pick this name as my website. It's way too long. Evora by DrBeckyLynn.com. And the doctor is DR. So Evora by DrBeckyLynn.com. You can Google Evora St. Louis. That's probably the quickest way to find me. But Evora, basically it's a sort of a boutique kind of practice. In that I spend a lot of time with my patients. My patients have my cell phone number. You know, I really sort of give the whole concierge, you know, type medicine, which I love doing. I love that so much. So I've sort of taken myself out of the corporate medicine 5-minute visit, so I have time for my patients. I do e-health. And so this can be done anywhere in the United States. Where I can just talk to you in general about what how I manage things, how you can use marijuana, you know, and basically I'm not your doctor because I can't prescribe you medicine and things like that. But I can, you know, discuss topics and answer questions and things like that. So they can find the e-health on my website.
Cool.
I also have social media, which you can go to Becky K. Lynn MD on Facebook and Instagram. And I also have at Evora Women's Health on Facebook. Yeah.
And can you talk about your education, your YouTube channel too?
Yeah. So if you Google Dr. Becky Lynn, you'll find my YouTube channel. And this basically started several years ago because when I was seeing patients, I found that I was telling many women the same thing over and over again. And a lot of women would say, I wish my husband could hear this, or I wish my partner could hear this. And so I was like, well, why don't I just record it? It's pure education. And it's education that we don't get enough of, right? Because, oh, sex is hush hush, sex is bad, which it's not. But in my practice, so many women come in and say, well, this is what's going on. What's wrong with me? And I'm like, you're normal. That's how it is. But people don't know because they get their information from, you know, pornography or movies or all this. So I basically created it to provide education to both women and their partners. So that way we can take some of, you know, hopefully prevent somebody from feeling bad about themselves because they think they're not normal when really they are.
Well, you know, like you said, it is hush hush, and I don't know why it's taboo for a lot. And like you said, it shouldn't be. I think conversation is very important to have with your communication, with your partner, but conversation. And, you know, I applaud you for having that relationship with your kid. Like I have the greatest parents in the world. At that age, when I had the sex ed class, we lived overseas. So my dad was in banking, and so we lived in Asia. Tokyo, came back here to the States. Philippines, came back to the States. and I missed the whole sex ed class. And we recently had a reunion, and I asked them. I said, because this topic came up, I think parents talking to their kids. I go, "Did you guys miss the whole?" They said, "We all did. It wasn't just you. We all did." Because I came back here to the States for high school. I know what to do, but I was like, I never had the topic. I never had this conversation, even with my folks. Maybe my dad, but so hearing this, and even with Corinne's kids, we talked about everything, and they knew that they come talk to us about everything. And I thought, how awesome is that? I think it just makes any child or even a parent-child relationship that much broader. So thank you for sharing your knowledge. Any last final words for our listeners? I know you covered a lot, but
I don't think so.
well, I appreciate that. Go to Becky's YouTube channel. Like she said, it helps break the ice if you're having issues with your partner talking, because sometimes us males are a little slow when it comes to communicating. So, but I thank you, Becky Lynn, Dr. Becky Lynn, excuse me. And you can find, and I'll put all your information on there as well, yeah. But you can find Becky at Evora, EVORA, Evora Center for Menopause and Sexual Health. And thank you so much again for your time. Great working with you as well. And we'll see you again.
Thank you.
And everybody, this is John Malanka with the United Patients Group. Be informed and be well, and we'll see you soon. Bye-bye. Hey everybody, John Malanka with United Patients Group. Be informed and be well. This segment is brought to you by Aspen Green. Aspen Green is just a handful of USDA, that's right, USDA certified organic hemp and CBD brands. And all of its hemp is grown from the perfect topography and climate found in Colorado. It is a family-owned business and is deeply committed to the science of providing only the purest hemp and CBD products for the best results and most beneficial experience. Its mission is to bring the therapeutic value of pure, organic hemp and CBD to people who seek supplemental relief through the use of healthy, natural products. Aspen Green is free from toxins and runs up to 8 different lab tests from bona fide third-party labs throughout its product line. It holds in high regard 3 foundational principles that guide every aspect of their business, actions, and interactions with their customers, partners, as well as their community. These are quality, integrity, and transparency. These will always remain at the hearts of their efforts to bring their beneficial products to consumers. Check out why purity matters at aspengreen.com and follow them on social channels at Aspen Green CBD. Use promo code UPGCBD for 20% off. Again, UPGCBD for 20% off at aspengreen.com.